A TB patient is on ATT drug, antituberculosis, and complaints of tingling in hands and feet. Which drug causes this? Rifampicin, B. Isoniazid, C. Ethambutol, D. Pyrazinamide. So we should know that these are the symptoms of tingling in hands and feet. It denotes peripheral neuropathy. So which drug is potential to cause this? Isoniazid. So isoniazid causes peripheral neuropathy. Okay, we can prevent this by giving vitamin B6, pyridoxine, as a supplement. A newborn has respiratory distress immediately after birth with meconium stained liquor. So what is the priority action? A. Immediate suctioning. B. Start feeding. C. Give antibiotics. D. Keep warm only. So here our priority action is to prevent the aspiration. So we need to prevent meconium aspiration. So what do we do first? We need to clear the airway. So immediate suctioning. Okay. So first and priority action is immediate suctioning. A patient with burn injury has 40% TBSA, total body surface area. Which formula is used for fluid resuscitation? So the most common formula used is Parkland formula using the total body surface area. So the formula is 4 ml into kg and weight of the patient into percentage of total body surface area. So this is the Parkland formula. So after calculating, we'll be giving half of the fluid in the first 8 hours. Yes. So this is a common formula. A psychiatric patient expresses suicidal ideation. What is the nurse's priority? A. Leave patient alone. No. Provide one-to-one observation. C. Give sedatives. D. Inform relatives only. So as the patient has suicidal ideation, our priority is to watch the patient closely. Yes, so provide one-to-one observation is the answer. A patient with renal failure has potassium level 6.5 milliequivalent per liter. What ECG changes expected? A. U waves. B. ST depression. C. Tall peak T waves. D. Prolonged QT waves. So in case of hyperkalemia, the earliest sign is earliest sign is tall peaked T waves. And later we'll have wide QRS. Later sign is wider QRS, and that will lead to cardiac arrest. Okay, so the answer is tall peaked T waves. Next is a child with nephrotic syndrome presents with edema. Which urine finding is expected? A. Hematuria, B. Glycosuria, C. Massive proteinuria, D. Bacteriuria. So we need to know this nephrotic syndrome. The symptoms of nephrotic syndrome is proteinuria, then hypoalbuminemia, and edema, hyperlipidemia. Yeah. So here it matches with proteinuria, massive proteinuria. Okay. A nurse is preparing vaccine under national immunization schedule. Which vaccine is given at birth? So the birth vaccine is BCG. And also we will give hepatitis 0 dose. Okay, so as it is not there, BCG is the birth vaccine. Next, a patient with spinal injury develops sudden bradycardia. and hypotension. What condition is suspected? A. Septic shock. B. Neurogenic shock. C. Cardiogenic shock. D. Hypovolemic shock. Of course, it is related to neuro, and you have to know this: bradycardia plus hypotension. Brady plus hypotension is neurogenic shock, because in other shocks always the patient will be having tachycardia. Okay, so brady plus hypotension is neurogenic shock. What a woman in labor has late deceleration on CTG. What is the likely cause? So late deceleration, okay, note this: late deceleration. A. Head compression. B. cord compression. C. uteroplacental insufficiency. D. maternal fever. Okay, you need to know this: variable deceleration. Variable deceleration reason is cord compression. Okay, cord might be compressed, so variable deceleration is happening. That is heart rate changes, fetal heart rate. Okay. Yearly deceleration. Yearly deceleration is due to head compression. Head compression, fetal head compression leads to early deceleration. That means due to the uterine contraction, the fetal head gets compressed, and due to that, the vagal nerve will be activated, and it leads to the reduction in the heart rate. Okay, once the contraction is over, again the heart rate will be back to normal, and this is very normal thing. Early deceleration, we no need to worry about it. Okay, and variable deceleration also is because of cord compression. That might be because of the position. Okay, if we change the position, the cord compression will be relieved and this will be relieved. But late deceleration is due to placental insufficiency, blood flow. Okay, placental insufficiency, that is very dangerous. Okay, so late deceleration is uteroplacental insufficiency. And the next thing, a nurse observes medication error by colleague. What is the appropriate action? Ignore it. Report immediately as per policy. C. Inform patient only. D. Confront angrily. So obviously we need to report immediately as per policy. Yes, we should not support our colleagues and we should not ignore it. Okay. So let's continue in the next video. Until that, bye bye.